I bet everyone has had a stiff neck before. You probably even chalk it up to leaning over your desk for too long while studying or doing classwork, which is definitely the most logical reason, especially for a college student. But for someone with hypochondria, a stiff neck could mean a million things, except for hitting the books a little too hard. A little pain in the neck sends the brain into a whirlwind, and next thing you know, you're on WebMD, and it's just what you thought, you have meningitis. So you're on your way to the doctor to confirm your worst fear. But it turns out your hours of classwork really did just take its toll on your neck, and you're fine. This is just one example of an episode that I've had. Hi, I'm Megan Warga, and my father and I are both diagnosed hypochondriacs. Hypochondria can be adult onset, and according to a 2014 University of Maryland Medical Center article written by Dr. Stephen D. Ehrlich, people who have anxiety, depression, or any other mental disorder are more predisposed to developing hypochondria. Hypochondria, also called health anxiety, defined by Dr. Jeffrey P. Stab, along with the rest of the Mayo Clinic staff in 2015, is the extreme preoccupation with your own health and fear of being seriously ill and the inability to be reassured otherwise. Today, I'm going to tell you some key symptoms, causes, the number of people who are affected, and treatments for hypochondria. To begin, a few symptoms listed by the Mayo Clinic staff in their 2015 article, Illness and Anxiety Disorder, that may be indicators of hypochondria are repeatedly checking your body for signs of an illness, worrying that a minor symptom or sensation is caused by a more serious underlying illness, and frequently scouring the internet for the causes of your symptoms. For example, I used to be very preoccupied with the thought of having meningitis. I would even strip down in front of my friends so that they could help me check my body and my limbs for purple spots. These are just a few of the symptoms that might indicate an underlying anxiety disorder, and they are important to watch for so you can seek treatment. The causes of hypochondria are not entirely clear, but the Cleveland Clinic staff listed a few possible causes in their 2015 article entitled Hypochondriasis, including having major stress, a major symptom that causes you stress, such as chest pain or a lack of memory, or having a pre-existing mental or anxiety disorder. The article called Hypochondria, the Impossible Illness, in January 2010 issue of Psychology Today, written by Jeff Pearlman, brings up the possibility of the disorder being learned or inherited through genes. Seeing my father take every symptom he had so seriously could have taught me to deal with my health in the same way. Or his anxiety could have been passed down through genes. Another possibility is that my anxiety was pre-existing, and the hypochondria developed from my anxiety and my obsessive-compulsive disorder. Hypochondria is fairly common, with Mayo Clinic estimating about 200,000 cases in the United States per year. It's usually developed in adulthood, with the few rare cases involving a person under the age of 14 being diagnosed. I began developing the symptoms at the age of 15 and was diagnosed at the age of 16. And here is a chart that shows the ages affected by hypochondria. Some treatments are pretty straightforward, including medicinal treatments for generalized anxiety or depression, such as fluoxetine, better known as Prozac, or paroxetine, also called Paxil. Other treatments outlined by psychologist Dr. Gail Martz-Nelson in the Psychology Today article from January 2010 called Hypochondria, the Impossible Illness, could be exposure with response prevention, where the person affected confronts their obsession directly. Martz-Nelson uses the example of a person being riddled with the fear of having HIV. So the person is directed to spend time with others who have HIV, perhaps visiting a clinic for HIV/AIDS patients, And then, over time, the anxiety level about that fear will diminish. To conclude, hypochondria is a form of anxiety that makes the affected person hypervigilant about their health. Now that you know the symptoms, causes, and treatments available to those affected, you can stop the progression of the disorder before you spend unnecessary time at the doctor's office for an illness that you more than likely do not have. Thank you for listening. My name is Megan Warga.